Hey everybody, how you doing? Uncle Vinny here. Grab a cup of coffee, sit back, relax, and enjoy the show.
Everybody, I'm Dr. Nick Circolone. I am so excited to be here as always. And I want to thank you from the bottom of my heart for watching our video. Today, we're going to be talking about something a little bit different. I'm going to be reviewing a specific technique called the ring dinger. I have a lot of patients that ask me questions about, do you do the ring dinger? What the heck's a ring dinger? And the answer to that is no, we don't. It is an adjustment that is known as a non-surgical manual spinal decompression. What that means is we're decompressing the spine through manual therapy. Okay? I'm going to let you guys judge that for yourself. Let's break down this whole procedure of the ring dinger. The ring dinger requires two things. Actually, it requires more than two, but two basic things. Number one, it requires a specific table, which is called a priority adjustment table. So we can call this adjustment a priority adjustment, and that's how I know it to be as a priority adjustment, not the ring dinger. Because I've actually had this done to myself, and I found it to be extremely uncomfortable. I didn't like it. So that's why I'm talking about this, because when you see this happening on this video, you think this is a great adjustment, these people are getting better from it. I'm not so sure. And we're going to go into a little bit of this as well. Don't forget, leave comments down below, subscribe, hit that notification button so you can get some more of our videos. And please, always leave comments, let us know what you want. So with this priority adjustment, we have the table, which is the priority table. And two, we have this towel. It's not a magic towel, it's just a towel that we wrap in a specific way around the patient's neck, and we pull, and then we give it a quick impulse. A lot of strength is used to get into that impulse because they're trying to get the cervical spine to decompress, the thoracic spine to decompress, and the lumbar spine to decompress. Whew, that's a lot of decompression, isn't it? I have problems with this because there's so much force that has to be placed into that area in order for us to make a difference in the lumbar spine by pulling on the cervical spine. Got a really hard time with that because there's a lot of structures that are in there that can be affected and be affected quickly. In the video, Dr. Johnson talks about fibrous adhesions. Okay, talking about fibrous adhesions, why do we have fibrous adhesions, how do they occur, and how do you know that they are there? What has he done prior to this adjustment? We don't know that, but I'm assuming, because he's a Palmer graduate, I'm also a Palmer graduate, that I know about these things. And he knows about these things. We take a thorough history, we take a thorough exam, and at the least, we're done an x-ray, okay? You're not going to see soft tissue in the x-ray. The only way we're going to see that is either through an MRI or a CAT scan with contrast. Not the best, the CT, but you can get enough information out of that. I personally don't like the CT for this. I'm a big MRI fan. So let's say he has all of this in place. Let's say all of this was done. He's done the thorough history, he's done the thorough exam, and he has advanced imaging. Now, you're placing a lot of force into that area, and specifically the cervical spine, because I'm not so sure we're getting it all the way down into the lumbar spine. Even though we're strapped in, or not strapped in, excuse me, bolstered in with these two bolsters on either side of the pelvis to prevent you from coming off the table. So a lot of force is being used. I can't say that enough. There's a lot of force going through here. So if that's the case, and he's done all of those things, and he's breaking up fibrous adhesions, What else is being affected? We know there's going to be pressure on the dura. We know there's going to be pressure on the artery, the nerve, the ligaments, the tendons. All of this is being affected. And are we making a correction in that area, or are we causing more damage to that spine? I have to say, I'm personally going to say we're going to be causing some damage. Over time, damage will occur. And with these adjustments, people get this electric shock pain through their bodies. And the doctor even says it in the video, this is kind of a normal, that's the healing process occurring. Anything that's electric feeling after an adjustment is not good. So if you're getting adjusted regularly by a chiropractor and you're experiencing electric type pain following the adjustments, or they're painful, or it takes days for it to feel better, you need to really let them know that, because that is not normal. Having that type of pain may be some other problem. Don't just take the doctor's word for it. If something doesn't feel right, let them know. That's not just with chiropractic. Any doctor, any healthcare provider, if you're having a problem, let them know. Communication is the only way things can be changed. As we look at this, I have some basic, biases, because what I see doesn't line up to the way I was trained. I have a postgraduate degree in orthopedics. I have a fellowship, which makes me look at things a lot differently. What are we doing to make the patient feel better? Now, I will say this. I've seen some really bad chiropractic adjustments actually help. And I've seen patients that I would go, wow, how did that help? But it does. So the spine, I've learned over 30 years of practicing, is resilient. It's amazing how much trauma it could take and not be severely damaged. It just amazes me. Not saying it doesn't, but it does. And repeated trauma to it will always cause something that we don't want, and that's future problems, chronic conditions. We can take acute and turn them into chronic, and that's what we don't want to do. And we can take chronic conditions and make them even more chronic. So with this adjustment, when I watch this, I have a lot of this thoughts in my mind. If you look at some of these videos that Dr. Johnson does, he's working on some other problem that's maybe related to the spine, but maybe not related to the spine. My question is, every single patient that he says he's doing something specific on, they're getting the same adjustment. They're getting the same adjustment? They get the priority adjustment. He does the neck crack. He does the low back crack. He does all of this stuff. And he's specifically treating these patients for this specific problem that they have. I have that's a whole nother show that we can do on, really? But here's the thing. If he's specifically treating one thing, why are you doing the same adjustment on every single patient? And it's non-specific. I don't think anything that he's doing is specific that's going to help. So when you adjust a patient, we want to be extremely specific that we're working on the area of complaint that's causing the problem and not making other areas worse. So if we're working on the cervical spine, we're not messing with the lumbar spine unless there's a connection, because sometimes there is a connection. But what I'm seeing is the same adjustment on every single patient, regardless of their symptoms. And I do have a problem with that. So when you look at these videos, think to yourself, what's going on, number one? Number two, is this going to help me? And number three, do I really want someone doing the same adjustment on me every single time I see them working on a specific problem? Because here's the thing. If you're getting the same adjustment every time you see your doctor, something's not right, because you're dynamic. You're changing. The goal is we start here and we taper things down, and then we give you things to help strengthen up those areas. Example, you come into the office, let's just use a car accident for an example. You have a car accident and you have a cervical whiplash. We want to decrease the pain and the irritation caused by the whiplash. Over time, you're going to feel better. We still have stuff that's destabilized. We have to stabilize that area. So after we're done treatment, we want to, during and after, we want to start adding in physical activity or physical therapy to help decrease the chances of these becoming a chronic condition and strengthening up the areas so we don't have something that's unstable. So as you watch these videos, please don't forget, leave comments, let me know what you think. And if you have any questions or want me to answer some specific questions, please leave them in the comments below. So don't forget to subscribe, hit that notification button so you can get more of our shows. Guys, I love you. Have a great week and be safe.